What is a blepharoplasty surgery? I'm Dr. Cohen with the Cohen Clinic, and I just want to take a second to explain this procedure because we get asked about it a lot. So blepharoplasty just means eyelid surgery. We are doing surgery for both the upper eyelids as well as the lower eyelids, but they age very differently. We treat them very differently. So with the upper eyelids, typically people are aging with excess skin, redundancy, laxity, a little heaviness in the eyelid. That is very easily addressed with skin removal. Sometimes we'll have to either remove a little bit of fat here in the inner corner or reposition it. We joke that's like dipping the pinky toe into the ocean of cosmetic surgery because generally it's fairly easy to get through. You have stitches there that live for 1 week, typically mild bruising, minimal swelling, and it can be a fairly easily or fairly accessible procedure to start out with. The lower eyelids can age differently, and we treat them differently as well. So with the lower lids, we typically are seeing contour change. So everyone hates under eye bags. What are those bags? It's normal eye fat that is living here in the orbit and protecting our eyeball. That gives the eyeball some cushion. As we get older, the retaining wall here that's holding that fat within the orbit tends to thin out with time. And the eye is being pulled down with gravity. The fat has nowhere to go because it's in the eye socket, so it gets pushed forward. That's what causes the bag. We combine that with a lack of volume here underneath the bag, whether it's atrophying and getting smaller with time, or getting pulled down and descending with gravity. The result is a hill right next to a valley. So we have to do two things. We have to shrink the hill. We also have to fill the valley. You can do that with filler or fat. If you're having a procedure, it makes sense to do that with fat. But we need to do something comprehensive so we can restore that really nice contour here along the eyelid so that the lid and the cheek are blended very youthfully. So that is a blepharoplasty surgery. In time, we can talk more about specific options for what type of blepharoplasty. That's something that's better done during a consultation because it depends a lot on your particular anatomy and your particular goals. So I hope this was helpful. Please follow along to learn more, and we'll talk more about this very soon.